allow the other colleagues, if any, who wishes to ask any supplementary questions to pose those questions, and then thereafter he may come last in asking a supplementary question. So that is the procedure we are going to adopt. How we then respond to these questions is extremely brief, concise, so that you don't have to give a whole speech, Honorable CS. Straight to the point, concise, and very brief. I will therefore be requesting the Senator George Mbugua, MP, to proceed to ask question number 01.
Thank you, Mr. Speaker, sir. I rise to ask question 19. I would want the CS to tell the House what measures the government has taken to ensure that reproductive health services are accessible to persons with disabilities in compliance with Article 43A of the Constitution, and B, could the Cabinet Secretary provide a list of all the medical facilities equipped with disability-friendly infrastructure and indicate the training programs developed and resources deployed by the government to medical practitioners to ensure they are adequately prepared to attend to persons with disabilities, and C, to tell the House what measures the government is doing to ensure that such services as occupational therapy, speech therapy, and behavioral therapy, which are essential for children with disabilities, are covered by the National Health Insurance Fund. Thank you, Mr. Speaker.
Honorable CS, you may now proceed to respond to that question.
Honorable Speaker and honorable members, I would like to take this opportunity to thank the Senate for inviting me to appear in this plenary and respond to the questions. Honorable Speaker, I would like to begin by first thanking the Senate for their indulgence. I am supposed to have appeared here 2 weeks ago, but I requested to be given time to prepare for the launch of universal health coverage, which we did during Mashujaa Day, and I want to thank the Senate for that understanding. The second, Honorable Speaker and honorable members, I would like to thank this esteemed House for the support, immense support, that you gave to the ministry in ensuring and enacting the 4 bills of universal health coverage that are going to change how we deliver healthcare in this country, and that for the first time as a country, we are going to be focusing and ensuring that the citizens of this country live healthy, vis-a-vis the previous, where we were waiting to repair broken health systems. So I really want to thank the House and the members for that support. Having said that, Honorable Speaker and honorable members, referring to the question regarding disabilities and how they are able to access health services, I would like to respond as follows. Persons with disabilities form a significant part of the world's population, yet as one of the largest groups, their rights are often the least advocated for. The Ministry, in collaboration with relevant stakeholders, is working tirelessly to advocate for persons with disabilities by developing and streamlining disability-inclusive policies and enhancing the ease of accessibility to facilities and services in the health sector. Honorable Speaker and honorable members, the Ministry developed the Kenya Health Sector Strategic Plan 2018-2023 that prioritizes health system strengthening to realize universal health coverage, and has further developed the rehabilitative services and assistive technology strategy of 2022 and 2026 to guide targeted investments to promote access for persons with disabilities. Disability mainstreaming mechanisms within the health systems are ongoing in health facilities to enhance the unhindered safe movements of people with a disability and access to reproductive health services. The ministry has emphasized on all health facilities, including level 4, level 5, and level 6 hospitals, to ensure the integration of disability-friendly mechanisms to enable the inclusivity of all Kenyans. In the recently concluded facility assessment preliminary report, the ministry evaluated whether the health facilities had disability-friendly infrastructures, that is ramps, lifts, disability-friendly washrooms, disability-friendly maternity beds, and wheelchairs, amongst other items. Out of the 12,483 facilities included in the analysis, 47% had at least one disability-friendly infrastructure. 82% had at least a ramp, 54% had wheelchairs, 15% had disability-friendly washrooms, and only 7% had disability-friendly maternity beds. Further analysis revealed that 80% and 42% of level 6 and level 5 facilities had disability-friendly maternity beds, while only 22% and 8% of level 4 and level 3 facilities had disability-friendly maternity beds. Reproductive health and maternal health services are offered in both outpatient and inpatient. The high accessibility in form of ramps, lifts, and availability of wheelchairs indicate that persons with disabilities can access the reproductive services. However, there is a significant challenge in provision of disability maternity friendly in the health facilities. The facility assessment has covered several other areas, and the ministry is packaging the information and will provide feedback to the counties to strengthen access to services, especially in maternal care, by increasing number of disability-friendly maternity beds. In addition to the above assessment, the ministry undertook a short survey of 97 health facilities in October 2022 and found that in addition to the above 4 parameters of access, individual facilities undertook various initiatives to improve access of health services by persons with disabilities. Following are some of the initiatives that have been undertaken. Services are brought to the disabled client, and that is happening at Baringo County Referral Hospital. Availability of staff trained in sign language, that's what is NEST at Bungoma Hospital, and sign language interpreters in clinics and outpatient department for the deaf at Kapsabet County Referral Hospital and Thika Level 5 Hospital. Stretcher bearers were at Kakamega Level 5 Hospital, and 5% of human resource recruited are people with a disability. We have go-karts to ferry people with disability from the gate. There is a rail in walkways, and specifically would like to single out Kericho County Hospital. And again, people with disabilities are provided with houses. Sign language interpreters, motorists, wheelchairs for staff and other officers, disability committee, and braille. This exists at Moi Teaching and Referral Hospital. Honorable Speaker, honorable members, on the second part of the questions, where we need to provide a list of medical facilities equipped with disability-friendly infrastructure and indicate the training programs developed and resources deployed by the government to medical practitioners to ensure they are adequately prepared to attend to people with disabilities. Honorable Speaker and honorable members, in line with the rehabilitative services and assistive technology strategy of 2022-2026, the ministry aims to scale up services to all levels of care, including community-based rehabilitation in line with the universal health coverage and the spirit of leaving no one behind. The ministry has undertaken training of all county directors of health and the disability assessment teams on disability medical assessment and categorization, and further developed the disability medical assessment and categorization guidelines to make assessment standards across the country. Training of county teams involved in disability assessment is done for those who request the national level, and it's done on a need basis. In a significant step forward, the ministry, with support from World Health Organization, is in the process of establishing an assistive technology center of excellence, which will offer training, innovation incubation, research, and development of local assistive products for users. To catalyze the provision of assistive devices, an organization called ATScale Global Partnership, the Global Partnership for Assistive Technology, We are working together to strengthen the pathway towards provision of assistive products to Kenyans who need it. The third part of the question, what is the government doing to also ensure that such services as occupational therapy, speech therapy, and behavioral therapy, which are essential for children with disabilities, are all covered by the National Health Insurance Fund. Honorable Speaker and honorable members, the ministry has prioritized training of unique specialists like occupational therapists, speech therapists, and behavioral therapists, and also provides post-skills training development for officers to equip them with better skills to manage patients with disabilities. As the House may be aware, honorable members, His Excellency the President ascended to the law the 4 bills, including the Social Health Insurance Act 2023. This act will ensure that no one is left behind in terms of access to healthcare services. As the Cabinet Secretary of Health, the act mandates me to develop a health benefits package that will cover all components of care, including rehabilitation services. The Ministry is working on the regulations and at the same time reviewing the health benefit package to ensure it is comprehensive and covers all spectrum of rehabilitation services needs with no exclusion. This will definitely reduce the out-of-pocket expenditure for people with disabilities. Additionally, the Ministry is also advocating for community members and households with children with disabilities to come out and seek health services to enable them achieve full potential and full integration into their communities. Honorable Speaker and honorable members, I hereby submit. Thank you.
Thank you, Honorable CS. Honorable Senator George Mugo. Pursuant to Standing Order 51C7A, you have the right to ask 2 supplementary questions. And supplementary question must arise from the primary question. It must relate to the primary question. So you may elect to ask those 2 supplementary questions now, or you may allow your colleagues to proceed to pose questions, and then you come last. Which option are you taking?
Thank you, Speaker. I wish to allow my colleagues to come in first, then I'll come in later.